Hello everyone, and welcome to Digital Healthcare, an update for the post-COVID world with Alan Hughes, the principal of LIT Healthcare. Well, we're starting off this morning talking about digital healthcare, which is a topic obviously close to all our hearts after the pandemic. And I'd like to welcome you all today and to introduce myself. I'm Zoe Buckingham, an international marketing consultant with a background in diverse private and public projects. So first of all, I'd like to thank all our sponsors. We have some amazing sponsors who have been so supportive and are from many different areas of finance and business. And our sponsors allow us to talk about all sorts of topics that, of course, ultimately impact on investment, on policy, and give us such a great understanding of current moves within industry. So this is our agenda for today. I've just obviously given us a quick introduction. I'm then going to hand over to Alan Hughes, who's here to give us a really interesting presentation, and I hope you'll enjoy it. And then we'll move on to questions and answers at 25 past the hour, if not slightly before. And please do think about your questions and put them in the questions box, because we love it when we get lots of questions from the audience. And so here is our speaker, Alan. Welcome. It's so lovely to see you again. Alan has spoken to us before about healthcare policy and strategy, and he has many interesting things to say today. Alan is going to be talking about digital healthcare and update for a post-COVID world, and he has 20 years experience in international healthcare advisory and works alongside providers and policymakers on the latest international trends. He's been involved in payment reform, NHSE policy, digital care, acute care strategy, and he has, as I said, spoken to us before about digital healthcare and what a difference it makes to actually put a little bit of the fourth industrial revolution into the healthcare system. And he's going to be talking about how it's different to how it was when he spoke to us early in the pandemic. So just some housekeeping notes before we get started. The slides will be available to download in the chat and on the website. And obviously, we've talked about the Q&A that we're going to be holding. So do put your questions in the chat box. I'm going to hand over to Alan and look forward to hearing from you, Alan. This is going to be really interesting.
Super. Zoe, thank you for that introduction. And it is both a pleasure and it's very interesting to be invited back again for third year running, because we can sort of look back and learn from what has or what has not happened over the last few years and sort of think about the future. Go ahead, please, to the next page, Peter. Super. So to help frame the conversation today, and I'll keep it to 15-20 minutes as promised, but the aim is to get through certain areas of digital care, not only from a patient-facing, what we're calling front office, but also the middle and back office areas of care, and I'll go into that in more detail. But as importantly, given we have such a wide, and you have such a wide group of participants and followers, is to take these perspectives from both an investment perspective, and by investment I mean not only from a financial investment, but also health insurance companies, corporates and others that might be considering, well, how much do I deploy digital care for my workforce or otherwise? Also care providers, so hospitals and people in the system providing care. And last but certainly not least, our friends in government who make policy. For today, any comments are very much given from an international lens. So the challenges that are faced that I mentioned here are very much impacting every health system. But as we move through the presentation, I will refer to the NHS a few times and the wider UK health system, Zoe, given that you're London-based. But just the aim is that the views are as international and broad as possible for your participants. Go ahead, Peter. Next slide, please. So let's recap on the last 2 years, and our conversations were usually in around the month of May or June. So when I have a date here for 2020, it's around about May, June of that month. So what we were dealing with from a health policy and funding perspective of digital care was using digital care to achieve some form of resilience. So even though it was an uphill battle, we saw in some cases surprising acceptance and adoption of digital care, as seen by that virtual handshake. And obviously the deployment of digital care into many areas that I'll go through in a second from that front office patient-facing perspective. And last year, frightening as it is to say this time last year, government started to look at, well, look, we have a huge use of digital care, and there was an incredible amount of emergency funding, purchasing of you name it, from medical supplies right into other deployment of digital care in this space. So we saw the door opening and lots of new channels as a result, leading from that. So from resilience to acceptance to, let's call it, a more slowly more regulated and recognized environment. Back to where we are now in 2022, where the top image of hospitals is trying to represent the traditional delivery of healthcare, but the two critical challenges facing every health system globally are the significant shortfall of staffing, as in healthcare staffing, so clinical and healthcare workforce, and sadly the unprecedented demand and growing waiting lists, which we'll chat about in about a minute in terms of today's poll. So in summary for this page, we move from resilience to digital acceptance, but sadly to the ongoing unprecedented patient demand for care in the traditional settings. And we'll come to that in more detail in a few minutes. Peter, if you go to the next page, I think it's very good. So the poll. So I think early in the conversation, let's just ask ourselves, based on where we are, and I appreciate the world economy is in an interesting place, to say the least, geopolitically. But looking ahead, given that we are now out of COVID, given that governments are now back on their feet, at least to a certain extent, will large healthcare systems, for example the NHS, have longer waiting lists in June 2023 than now in June 2022? And I appreciate that's a difficult question, but would love to hear what you think. And then we'll review the results and have a little look at the analysis towards the end. Thank you, Peter.
There we are. My goodness. A lot of people saying that they think they are going to be longer waiting lists.
Well, okay, thanks for the speed as well. Okay, my goodness. Okay, that's helpful as we get through the dot. Okay, so just to build on that, a year ago when Zoe and I chatted, in NHS England, so only in England, there were 5 million people in June 2021 on that elective waiting list, so non-emergency care. And we spoke about the use of different types of digital care that would help get the waiting list back to normal in 2023. So that in brackets at the top, I dropped in what it is currently. So the current waiting list has grown to 6.25. So it's grown significantly in the last 12 months, sadly. Bearing in mind, though, we did have COVID right until a few months ago. So let's see how the year progresses and how much digital care will help to reduce that. Peter, thanks for that that poll and sharing those slides. Go ahead, please. Okay, so back to the presentation. So let's look at digital care from an investor perspective, and I picked 3 companies just for no particular reason, but 3 companies that happen to be in the news a lot and get significant investor coverage. Teladoc, a US listed digital care business, Babylon, UK, but now listed in the US digital care business, and Ada, it's a German digital care business. So just given their valuations as of 2 years ago, so let's go across the top first of all. The idea is that the size of the ovals gives it an indication of how the valuation grew. So as we were 12 months ago, right still in the middle of COVID, unclear what the future looked like, Teladoc had an incredible valuation of $25 billion. So significant focus from investors. And when I say investors, across the board, not just specialist investors in the area of digital care. And companies like Teladoc would have benefited, as would have others, and we'll come back to that in a second. And those companies now are back towards, and let's say, more familiar valuations, as are many companies at present. But bear in mind, there's been a significant technology sell-off along with other challenges in the last few months. So that's just one useful yardstick to keep an eye on. Babylon, very similarly, double valuation in the middle of COVID and has now softened back. Zoe, I prepared these slides for you in late May, so obviously the market's extremely turbulent these days. So the numbers are not meant to be exact, but they do certainly give us a message in terms of where valuations have come from, and hopefully will stabilize soon.
Alan, could I ask, could you tell us what those companies have been involved in? It would be just interesting to hear a little bit more about that.
Yeah, so in a nutshell, Teladoc is it's a good 12, 15 years old. Started in that virtual care space, but moved into the software as a services market. Did a significant acquisition about 2-3 years ago of a business called Livogno, which is in the diabetes space. So it involved the remote monitoring of diabetes. And that's when its valuation significantly expanded. So that would have helped it grow in valuation from 2020 to 2021. So it's a mix. Zoe, in answer to your question, it's a mix of the virtual care and also the remote monitoring of millions and millions of diabetes patients in the US and they're internationally as well. Babylon, very similar, started in the UK, but then went to the Gulf, East Africa, and is now very focused on the US market. And Ada, I have to confess, I don't know the business super well. They have an alliance with Siemens, the big German healthcare business or technology business, and they're, as far as I know, quite German focused in terms of their market coverage. I suppose the bottom line on this page is that consolidation and cross-border M&A in this space is well underway, and the large players, and this was one of our themes last year, Zoe, was that you needed to really have a good M&A war chest to keep growing and to survive. So most of those large players are well funded and are on an M&A expansion as we speak. Go ahead, Peter, next page, please. So please bear in mind these numbers, they're from CB Insights and they finish in 2021. So I'm quite curious to see what 2022 will look like. But in a nutshell, you can see the exponential growth of the amount of funding, right up to $57 billion last year. And then you can see the curve represents the number of deals, which similarly spiked or hockey sticked in the last year as that significant amount of attention turned towards digital care. And then I just threw in that stat at the end that there were 85 digital healthcare unicorns formed in 2021. So still an attractive, needed area. Definitely rode a wave of technology investing last year, and I think if I can be so bold, I think it'll be one of the more resilient areas of technology investing this year. But it will be interesting to look at the numbers as 2022 progresses. Go ahead, please, Peter. Okay, so the slides are not the clearest, Zoe, but the aim here is just to show a similar trend across 3 big US listed companies, Teladoc, Zoom, and I just chose PayPal as I appreciate it's in financial service, but to show the comparability in terms of the sell-off, while the curves are not the exact same. But the idea is that while these companies are still growing and really supporting a lot of healthcare systems, that companies like Teladoc have been impacted a lot by that sell-off that is affecting the global markets at present. Go ahead, Peter, next page. Okay, so this page it's a recap of 12 months ago, and it's just to remind ourselves of what do we mean by front office or patient-facing digital care. So on the left, we have primary care, community, and corporate. So let's say the type of care that you or I might use in our community, either through our family doctor, physician, or maybe something that might be offered through our employer, such as well-being and other online care. And then also acute, which is hospital and secondary care, followed by tertiary care, which is university hospitals, so the bigger hospitals where you have research and professors of medicine and so on. So across the top in primary care, we saw and continue to see the use of remote consultations, and an area that's exploding is the mental health space, where companies are buying packages from companies like Teladoc, as an example of one, where they buy these systems and platforms so that employees that might be dealing with stress and have other challenges, where these are benefits that are being introduced in the workplace globally. So we'll see a lot more of that as time goes on. Disease management, I mentioned areas like diabetes earlier. Scheduling and staff rostering, so that's across the board, whether you're a nurse in the community or a GP with a physio that comes in a day a week, all that is thankfully moving towards a more digital online approach. Telemonitoring and diagnostics and home tests, so areas like sexual health, well, COVID, needless to say, like it's just exploded. And one of the positives that we'll see from COVID is how a greater acceptance of that type of testing and diagnostics will continue. Plus online prescriptions, as we saw for both the elderly and for all during COVID. So lots of use of digital care in those community settings. In acute or in the hospital setting, yes, there still is a long way to go around using digital in capacity management, but from the moment that a patient arrives in a hospital, whether that's through an emergency admittance or an elective admittance, their route or their care pathway is much more digitized than in the past, but there's a long way to go in many cases. I appreciate that's a hospital by hospital, system by system comment, but there's a significant adoption recently. Aligned to patient portals and discharge management. So Alan's is a patient, but at 12 o'clock on Friday, Alan will be discharged. So the porter knows, the people in catering and so on, everyone knows. So there's a much greater visibility than in the past, thanks to basic things like online rostering. I definitely won't get into robotic surgery, Zoe, because I'll probably get lost. It's such an incredibly complex area, but it's incredible what can be done. And needless to say, once you start getting into areas like that, it leads to other related and ancillary areas of care. EHR, electronic health records, is still there. Challenges of integration are keeping all my former consultancy colleagues very busy, and will continue to. It's a huge area with significant opportunity in the space for consultancies and many as we try to integrate care. And then care innovations, it's related to the robotic surgery point, where as we introduce one area of innovation, it leads to another. So digital care is aligned with the power of artificial intelligence or data and analytics, and we will continue to see healthcare be transformed in terms of how it's accessed and delivered. Go ahead, please, Peter. Okay, so what do we mean by front, middle, and back office? And these might be quite corporate and financial service terms, but the idea is that the front office is what we've chatted about in the last few minutes. So the use of videos or online consultations. The camera represents imaging and x-rays and how we analyze the patient's diagnostic. Chat boxes and the academic, there's been a significant adoption of how patients are communicated to by clinicians during COVID via the front office. The next, or the ongoing, and what I expect to see a lot more of, is the use of digitization in the middle office and the back office. So time to get digital end to end. And there's a little, I just put in that dotted line to represent the walls of the hospital. The idea being that from the front office, you should be looking out the door and out towards the digital front door of the hospital, whereas hospitals and big healthcare organizations are you still there, Zoe? Are still in place. So Peter, if you go to the next page, please. Perfect, thank you. So if we break down the middle office, areas of activity in the middle office are regulatory, so how hospitals and care providers report and are monitored on their activities. Reporting represents just how management communicate to each other from a clinical, operational and financial perspective. And then risk management, so mitigating risk and monitoring risk. So there's a huge opportunity to adopt dashboards, electronic dashboards, and that's what I'm calling the middle office. The huge, even bigger opportunity then is the back office, where, as you can imagine, I am taking a hospital as an example, because in any big university hospital, you might have 3,000 to 5,000 employees. They're essentially cities, significant labor-intensive organizations. So there's a huge amount of business processing when it comes to salaries, payroll, and other transactional activities. Then in terms of care-related activity, you have laboratories and pathology tests, so where there are hundreds, sometimes thousands of things like FBCs or full blood counts being done every day in a hospital. So again, the aim here, Zoe, is we're trying to show that it's not, while it is of course about the patient, it is of course about how the clinician interacts, but we do have to take that wider lens view across the end-to-end reach of the delivery of care. So I put a little bar across the bottom to show how sharing of care records, and that this is another area that will keep both people like Philips, Siemens, the big corporate providers, Cerner, and then also the consultancies, in terms of helping the hospitals and healthcare organizations to operate across that spectrum. And so care records will continue to help us join up the health and care processes. So that's a space that will continue to be very busy across those many areas of activity in the hospital. So the bottom line there is that, yeah, so no, you're fine. So essentially, as digital care becomes bedded down, we're seeing other areas of care that will become more, will adopt more digital care as we move on. We're coming towards the close, Zoe, and you and I, we had a little debate about this page, and I'll get to the fork in the road in a second, but the aim of this page is to try and look at what we've come through in terms of direction and policy from a government perspective. And so if you're sitting in a Ministry of Health, a Department of Health, anywhere in the world, and you've got through COVID, or at least done your absolute best, and no doubt invested significant amounts of funds into healthcare to deal with COVID, to deal with the challenges of vaccinations and other programs in the last 2 years. But sadly, you're faced with two challenges, still, not in every system, but in many healthcare systems: unprecedented waiting lists and the ongoing global care workforce shortage, which, as we know, can be enabled through digital care over time. However, you as a government, either a senior civil servant or as a policymaker in a ministry, you're faced with this. You've invested billions in the last few years to support COVID and these programs, but how do you balance this with the wider economy? And then also, meanwhile, you have a significant amount of patients, voters, and members of the public, citizens, who really need care, but the people that care for them need increased investment. You need to hire more people, and also digital care is an area that can support this. So naturally, I'm going to be a proponent and supporter of increased digital care funding and increased deployment of innovation. So the fork in the road, I think when we debated last week, Zoe, was a poison pill, but it's a difficult decision for people in policy. So I just came up with fork in the road, and the reason it's an actual fork is that it just shows that sort of direction. It's almost, you have to pause for breath and then see where the government goes. So I think the closing comment, Zoe, is difficult fiscal decisions ahead for all governments, and needless to say, it's a difficult geopolitical and trade environment as well. And thank you, and that brings to the end of the presentation.
Alan, that was absolutely fascinating. Thank you so much. I felt as if I learned an awful lot, even having seen the slides previously, but just the way that you talked it through and explained it to us. And I think, because I think at the beginning of this, we were getting some questions about, what exactly is digital care? And I think you've given us a good canter through the different types of solution that it could actually encompass. And they're very varied. And I think that's the point, isn't it? That it's not just one idea. It's so many different ideas which brought together can actually make a huge difference to care and waiting lists and so on. And we've had a question from Clive Bullen asking, okay, if we're putting in all these digital solutions, oh, sorry, it's not Clive for that one. It's Hugh Purser, sorry. Hugh, when will these digital solutions and tools really impact the growth in waiting lists, because they're obviously an issue at the moment?
Yeah, if Peter's still there, could you go back to that page that was beside the poll? If Peter's still there, please. So the slope, yeah, and then the one just after that, please. You know where we had the decreasing slope? There we go. So look, it's a very, very important and very good question. So when I dare I say it, I'm going to remove the year 2023 from the bottom of this slope. I hope you don't mind, but a year ago, I saw areas like teleradiology, so the remote reading of imaging, and then the better use of triage and preventative care, again using these solutions, and then using digital care to look after people when they leave hospital, so enabling people to go home earlier and freeing up capacity, particularly in the system. I suppose it's every day of the week. These are being deployed in various shapes and forms, and it sort of does come down to the local healthcare system, and by that I mean both the national policy to adopt and support and fund these, and then secondly, how those funds are used in our local healthcare providers. So I suppose to give you the comfort, a lot of these innovations are well underway. The technology's there and improving every day as it does. How it's deployed is very much on a case by case, region by region. But I continue to be amazed at the pace of adoption. So it will happen. But sadly, the poll that we had earlier that Peter showed us, Zoe, I do agree that it'll be a comparable number next year from an NHS England perspective, mainly due to the workforce challenge.
Thank you. That's interesting, Alan. And I think that's the point, isn't it? It's to do with the obviously overcoming the various challenges locally, because as you've shown here, if all of these concepts are implemented, it can make a big difference. But then there has to be a take-up by the individual NHS trusts and at national level as well. So that's great. It's great to show it so visually, isn't it? Another question that we had is, which organisations will most actively see most active growth in supporting health systems? So what kinds of solution providers are going to be the ones that are really going to sort of benefit from all of this transformation? And obviously we can see a kind of an overview here, but how would you put that in terms of the technical solutions?
Okay, so I'll try and I can think of two groups, and maybe I'll think of a third in a second, but two groups that are very busy in this space are what they call the vendors. So the big IT vendors, companies like Philips, Siemens, Cerner, who manage, provide, and offer healthcare record solutions. So these are organizations that can go into a healthcare system and a hospital, and they help to digitize a lot of the activities. And aligned to that, you'll have digital consultancies, so advisory companies who will help the healthcare providers to choose to then implement and monitor those solutions. So two areas that are very busy and will just get busier and busier over the next few years and further are those providers of the solution, so the providers of the technical solution, and those that help to consult and choose and deliver those or implement over the next few years. So they're two groups that are very busy and will continue to grow in this space.
That's interesting. Thank you. And Clive Bullen asked about preventative medicine. So how is digital being used to stop problems before they occur, guiding people towards good life choices and so on? Is that part of the package currently in the UK, and what's the situation internationally?
So one interest, preventative, yes, is an area where digital care is being adopted quite quickly. And I'm appreciate I'm not answering the question directly, but insurance companies are increasingly offering their insured base wider plans and access to new plans where there is an element of preventative care. So they obviously always covered scans and diagnostics and X-rays, but there is an increased focus, I noticed, from health insurance companies, so private medical insurance, to offer their insured base much more when it comes to preventative medicine. And if I can speak openly, that the benefit there is that it helps the patient to know sooner if there is a problem, and if there is a problem, how to mitigate and resolve it. But from an insured perspective, it makes them look more, it helps them to be attractive and improve the plans that they offer to both their directly insured and the corporates that they offer their plans to. So to Clive, you probably have picked the one area that will see and is seeing the greatest adoption of digital care, as it is such a technology. It is already a very technology enhanced area, thanks to the incredible innovations we've seen with video and screen technology over the last few years.
Thank you. Yes, thank you, Clive. It was a great question. And we've also had a question about what kind of budgets are in place to actually fund this sort of incredible innovation, which is obviously going to be, so beneficial to us all. But sort of, does the money exist? Which is, I think, a great question.
Yeah, no, it's good. So some countries are devoting. So this comes to the sort of policy hat and where governments are focusing funding. So one country that I have seen in the last 12 months really accelerate its focus on funding and regulation of digital care is Germany. And I might get the abbreviation wrong, Zoe, but I think it's called the DIGA, the DIGA, which is German for digital act. It's an act of law that has ring-fenced, I'm going to get the number wrong, but let's say it's 4 billion euros, so a significant amount of funding that is ring-fenced to support the deployment of digital care as a patient is treated. So, for example, prior to this act, I would have, if I was discharged from hospital, I'd be given my script and my aftercare schedule, and off I go. And whereas now, thanks to this law, in there will be an allowance or a funding from the government where I might have, I don't know, access to one virtual consultation with a physician or some element of digital care, maybe a follow-up X-ray. I don't know exactly how that 4 billion euros will be used, but that's an example of one country that has introduced ring-fenced funding and has introduced a new law only in the last 12 months to support that area. I mean, I'm probably being unfair only mentioning one country. I'm sure there are many states that are introducing, like the NHS, obviously through NHS Digital, and NHSX has been focusing on this area for many years. So there are many examples of funding that is devoted and focused on this area.
Well, that's great to know that it has actually been ring fenced, because otherwise you could imagine it kind of getting drawn into other areas. So no, thank you, Thomas, for that. Thomas Brooks, for that question. It's a question also about whether the NHS, this is about the UK, obviously, the NHS trust boards are kind of fit for this process. That there's a whole educational piece, isn't there, around kind of understanding what this really means, and what the risks and benefits of it are. There's also, we've had some wonderful questions today, actually. Question from Ted Rees about, do we have the governance structures in place to adopt more AI-based diagnostics? So I wonder if you could sort of answer both those questions really, Alan, about sort of the fitness of the boards to deal with these very sort of grave issues around personal data and having sort of the digital experience to work with this type of innovation.
Okay, I'll try and take the board fitness one first. I think if we step back from digital care, board fitness is and wider governance is an area that needs constant review. It's most of those leadership organizations, they can never stand still, and they don't stand still. So at any point in time, I'm sure there'll always be an area of governance that might need a topping up in a certain skill set, or maybe a skill set's less relevant now, and a refresh. So in a loose manner, I'm going to answer that question and say some will be, some less so. But board fitness is sounds like a sport. It's something that is, it's an ongoing process, as most boards know, and
Yeah.
so yes, some boards will be good to go, and others will sadly be lacking in certain areas to adopt some of these innovations. And then the second question, Zoe, was
The second question was around AI and governance, because obviously a lot of these technologies rely on a huge amount of personal data.
Yeah, so governance is, it's early days, which links to the last question, as I see you pair them quite nicely. No, it's a moving feast. Everybody's learning how to deal with the use of artificial intelligence, the significant firepower of data and analytics. I don't think people really know what can be done with it yet. So how can you regulate something that's has constantly moving goalposts? So very early days in terms of the governance of those areas, and but it will happen, because as governments fund and create devoted resource, usually the regulation follows. So more, I'm sure if we chat in a year's time, I would imagine we'll have seen even further focus on governance in this area.
That'll be an interesting topic for our future talks. Thank you, Ted Rees, for that one. And we've also had another question from Ted about the revolution taking place in genomic medicine, so diagnostics, therapeutics, and research. And do you consider that, Alan, to be part of the digital domain, or a kind of a different branch?
No, it's a good challenge. I've always, in previous years, I've always put a pen through personalized medicine and genomics. Yes, it is related. It's not. It's an area I haven't covered closely, I have to confess. But for today's conversation, it was very much the patient-facing, and I suppose the analysis of that care. Yes, as artificial intelligence and data analytics gets stronger and more equipped, I'm sure personalized medicine and the use of genomics will continue to support us with predictive medicine, and being able to say that based on my personalized medicine profile, that I don't know, whatever risk of diabetes might be there, that definitely will continue. But it's not something I went into today. Happy to on another time, but it's not one I went into today.
It's certainly a fascinating area. How are hospitals prioritising areas for digitisation? I mean, obviously you've got things, all sorts of different areas. You know, where do they start?
So one usual prompt is regulation. Is where, due to patient protection and protection of records, where there will be a certain focus from the regulator in each system to digitize activity and records. Other times it can be simply the the management of the hospital, for example, where they see the need is greatest, and each organization is different based on the skill sets and how they have focused, or what crises or challenges they were facing. So to give a straight answer, the regulatory will drive certain prioritization, and then the local expertise and the local capability will be the other driver.
Yeah, that makes sense. And I guess based on the demographics of the populace in that area, that could be another factor. So yeah, I guess it's got to be quite individual, hasn't it, as well as framing government policy. So it's an interesting balance there. You has asked what the roles of clinicians are in healthcare innovation. So I know that a lot of clinicians do actually work for life science companies, don't they? But how much sort of interplay is there between the people who meet with the patients and are at the sort of the sharp end of delivering care and the solutions that are actually put in place?
Critical, essential, and other words of that note. Very few of these, if any, innovations are feasible without the clinical oversight, clinical involvement, and clinical approval, given the clinician has the ownership of the patient. That this is very much the front office, or that's the original areas of digital care that we talked about. So that the usual triangle when it comes to introducing innovations like this is that clinical insight. Does it help the clinician to deliver the care better? Does it help the patient get a better outcome? And does it help the overall system, freeing up beds and so on? And then the operational feasibility, can it be done? If so, how can it be done? And then always budgets. Who pays for this? Is it something that's centrally funded, or something that a hospital might need to fund themselves? By the way, I shouldn't focus so much on hospitals, as we are supposed to be more shift left and carrying in the community. But I'm just using hospital as it's an easy entity with a budget and a management team to use when answering these questions.
Thank you, Alan. That makes a lot of sense, and it's great to hear that clinicians are, as one would expect, at the heart of these care decisions and policy decisions. So, Alan, it's been such an interesting talk today. I have to say, we've still got so many questions. We could have gone on for another half an hour at least, I think. But I think that is just a testament to how interesting this talk has been, and how much you've covered, and how much you've made us think about the different areas of digitized healthcare that we could look at. So perhaps there could be a series at some point on all these different matters. So I would like to thank you, Alan, for a really interesting talk. It's very kind of you to give up your time today, and I think we've all really enjoyed it and got a lot out of it. I'd like to once again thank our sponsors, such a diverse range of organisations who all don't just sponsor the FS Club events, but also participate so actively, and that's absolutely wonderful. And we have all these incredible events on a constant basis. So I wanted to just make sure that you can see all of those before we sign off, and do please attend as many as you can. They're all fantastic events, whether they're digital or in person. So we look forward to seeing you again soon, and I hope that you enjoy the rest of your day. Thank you. Goodbye.
Thank you.